Hi everyone! In part 1, we demystified premiums and cost sharing. In this second installment, we'll look at how insurance plans determine what they pay, what you might still owe, and the paperwork involved. Specifically, allowed amount, balance billing, in-network versus out-of-network providers, claims, and the explanation of benefits.
All right, so let's get right into it. You see, this whole process really kicks off with one single fundamental choice that honestly sets the stage for everything that comes after, and that is which healthcare provider you decide to see. It might not seem like it, but this one decision, it has a huge impact on what you'll ultimately pay for your care.
So you've got two main paths you can go down. On one side, you have your in-network providers. Now, you can think of these folks as being partners with your insurance plan. They've signed a contract and they've agreed to accept a pre-negotiated rate for their services. This right here is the foundation of how costs are controlled. But then, on the other side, you've got the out-of-network providers. They don't have any kind of agreement like that. And because of that, they're pretty much free to charge whatever their full rate is. As you can imagine, that often leads to much higher and frankly much less predictable costs for you.
So here's the most important takeaway, the one thing you really need to remember. Before any non-emergency service, whether it's a doctor's visit, seeing a specialist, or a planned hospital stay, just take a moment, pause, and confirm that they are in your plan's network. Seriously, this one simple check is your best, most effective defense against those dreaded surprise bills.
Okay, to make this all a little less abstract, let's walk through an example together. Let's say you've just had a medical procedure. Everything went well. And now the provider's office sends out their bill. Their standard charge, their sticker price for this service is 15,000 rupees. But, and this is a big but, if that provider you saw is in-network, your insurance company doesn't really care about that 15,000 rupee number. Instead, they look at something called the allowed amount. And this is that special negotiated rate we were just talking about. It's the absolute maximum price your plan has agreed to recognize for that specific service.
So, sticking with our example, let's say your plan's allowed amount for this procedure is 10,000 rupees. Right away, you can see the gap forming, can't you? The provider's bill says 15,000, but the insurance plan says, nope, we only recognize 10,000 of that.
And that, of course, leads to the big question, what in the world happens to that extra 5,000 rupees? Does it just vanish into thin air? Well, the answer comes all the way back to that very first choice you made, whether you went in-network or out-of-network.
This brings us to our second section, where we examine that very billing gap. If you stayed in-network, your provider has contractually agreed to write off that difference. It's like a discount. But if you went out-of-network, well, that's a whole different story.
And that story leads to a practice called balance billing. It's really exactly what it sounds like. The provider bills you, the patient, for the balance, for the difference between what they charged and what your insurance plan was willing to pay. And here's the real risk. Going back to our numbers, if you went out of network, you could absolutely get a bill in the mail directly from that provider for the full 5,000 rupee difference. This right here, this is exactly where most of those awful surprise medical bills come from. Okay, so now that we've got the money side of things, let's follow the paperwork. After your visit, a whole series of documents starts flying back and forth between your provider and your insurer. It's this paper trail that ultimately decides who pays what. Everything kicks off with something called a claim. You can think of it as the official invoice, the formal request for payment. Now, most of the time, you don't have to worry about it. Your provider's office submits it for you. It's filled with all these standardized codes that basically tell the insurance company exactly what services you got so they know how to handle the payment.
Once the insurer gets that claim, they process it, and then they send you a document. This one is called an explanation of benefits, or you'll see it as an EOB. The best way to think about it is like a receipt or a report card for your medical visit. It breaks everything down, what the provider charged, what the plan paid, any discounts you got, and finally, what you might still owe.
Now listen closely, because this is probably the most important thing to know about this document. Almost every single EOB you ever get will have the words, "This is not a bill," printed on it, usually in big letters. And there's a very good reason for that. It is hands down the most misunderstood piece of paper in this whole process. An EOB is just a summary. It's just a report. It is not asking you for money.
So what's its purpose? It's purely to keep you in the loop. You should always look it over, check that the services listed are the ones you actually received. The actual bill, the one you need to pay for your share, like your copay or deductible, that's going to come in a separate envelope, directly from your doctor's office. Okay, so we've gone through all these terms, all these documents. What does it all really mean for you? Well, it all boils down to one word: empowerment. When you understand this language, you stop being just a passive recipient of confusing bills. You become an informed, proactive healthcare consumer. You can almost think of this knowledge as giving you a new set of superpowers. Suddenly, you have the ability to look at your medical bills and actually understand them. You can spot potential mistakes on your EOB. You know how to take steps to avoid those nasty out-of-network charges. And maybe most importantly, you know how to ask the right questions to your provider and your insurer.
Understanding these terms helps you read your medical bills, identify potential errors, and avoid unexpected charges. In the final part of this series, we'll delve into the codes and processes behind billing: CPT, ICD, HCPCS, DRGs, as well as clearinghouses and coordination of benefits. See you there!